Why do we not offer pain management for medical procedures? And why do you offer pain management?
Well, I'll tell you a little story. Well, a personal story of my own in the context of IUDs. I myself have had 3 IUDs, all without pain management. And it freaking hurts. It is so painful. And I'm someone who I think has a pretty high pain threshold, like almost passing out in all of these procedures. Once you've experienced that, you never want to put another woman through that kind of pain, especially in the context of a medical procedure where it's already feeling like they're charged. I really feel like the bar is set so low in this area. It's like, why are we not using pain management? This seems so simple to me. When people learn that, one, they can trust me, but also they can trust themselves, that is where like the magic happens. And I want to encourage women to trust their own bodies.
High off the charts. We have a theme happening lately in the series of podcast guests that I've had. We're all about women's health, and I brought a dragon to show us the way. Meet Dr. Alex Dragan. It's the year of the dragon. It's the year of the fire horse, but in this studio, it's the year of the dragon. So thank you for joining us. We're going to talk about women's health, and I have lots of questions because Dr. Dragan does some really cool things in her practice, which aren't done often in the naturopathic world. Pioneering.
Oh, wow. Thank you so much. I'm so excited to be here.
I mean, it's the tea. And there's a lot of things that you're doing that I think even like the regular conventional world isn't necessarily doing. And I would love to understand why you do the things that you do and how come you came to the decisions you did about like how the services you offer are offered the way they are.
Yeah. Cool. Go ahead.
Okay. So one of my most important things I want to get across to the female population is like pain management. Why do we not offer pain management for medical procedures? And why do you offer pain management?
Well, I'll tell you a little story. Well, a personal story of my own in the context of IUDs.
Okay.
Right? So I myself have had 3 IUDs, all without pain management. And it freaking hurts. It is so painful. And I'm someone who I think has a pretty high pain threshold and like almost passing out in all of these procedures. Yeah.
Oh my God.
So it's like, once you've experienced that, you never want to put another woman through that kind of pain, especially in the context of a medical procedure where it's already feeling like they're charged. I don't know, like I know growing up, I had a great medical doctor, but I always felt nervous going there. I never felt like super comfortable spilling all of my secrets, you know? So I think that's part of the reason why I do this. I never thought that I would do a PAP or insert an IUD ever in my naturopathic medical school. But once I kind of experienced that, like that change in women when they've experienced pain in the past and it's much more comfortable when we're managing the pain, it was like, oh my God, I need to do this, and shouted from the rooftops.
Okay, I have so many questions.
Yeah.
I empathize with that, where you just said you don't want to spill all your secrets to your healthcare provider. I just went to Life Labs. I went to the lab just like an hour ago to get my blood taken because my provider wants me to do some tests. And if I caught myself feeling like to the phlebotomist, I was just like, oh yes, okay, yeah, I'll go over here. No, oh, do you want me to, how much pee do you want? And, oh, sorry, I didn't. It feels like I'm doing, like they're doing me a favor and I'm bothering them.
Yeah.
I have that feeling like I'm bothering that person whose job it is to like do the thing. And I also feel that way with my healthcare provider where I'm just like, oh, I just have one question. Like, do you mind if I ask one question? And this is in settings of just me doing like preventative screening of things. I don't actually have a concern right now. So for somebody to have that kind of feeling of having to summon a kind of bravery to bring up stuff that are sensitive topics and maybe it makes the provider uncomfortable, that must be even that much more challenging to sort of like say, this hurts.
Yeah. I remember lying there on the table, like I am about to pass out. can you please just shove this thing inside me? Like, just get it done. And she was like, did she use freezing? Because this hurts like in a weird way. It just feels wrong. The cervix is innervated differently than like your skin. So you don't feel pain the same way. And maybe that's hard to communicate when you're feeling those feelings. It's innervated by the vagus nerve, which, you know, governs our nervous system, fight or flight. And so a lot of people get like nauseous and AT and just feel strange. And that's a different kind of pain. It can be really hard to communicate that. So in my, you know, four walls, when I'm with someone, I really want to make them as comfortable as possible. And consent is throughout the whole procedure. You can say no at any time. We can stop at any time. If you say no, as I'm about to put the IUD in, we stop, right? Like, this is your procedure. I'm just here to offer you, you know, all of the options and all of the services.
Why does that feel so revolutionary?
I don't know, because we live in a patriarchy.
Is that it? Is that it?
I don't know. I mean, I've had patients tell me that like they've had polyps cut off their cervix, and the gynecologist tells them you won't feel pain because the cervix has no nerve endings. It's like, I'm sorry, who are you to tell me how I experience a procedure that is quite sensitive? You can't see what's happening unless you have a mirror. You know, it's so vulnerable. So I feel for any woman, even just getting a pap test can be so hard and traumatic. And even if you've had no sexual trauma, you could be traumatized by a stecula.
Right.
So, you know, I think it's important because these devices and procedures such as PAPs are so important to women's health that people are avoiding them because of fear of pain or because of past traumatic experiences.
Yeah, I get that all the time. All of my, like when I have this conversation with my female patients, I'm just like, have you considered an IUD? There's an immediate reflexive, no.
Yeah.
Why would you even suggest that you're going to do that to me? I'm just like, hang on. And then I always follow with, listen, I am partnered with a clinic that offers IUDs and other pelvic services, like screening of things and all kinds of assessments. What if I referred you to this very special group of women who are really woke to pain, trauma, information, and empathy, and then also like really consensual along the way? And they're always just, first they're in, I have to think about this, a kind of like disbelief that that kind of thing exists, and that maybe I'm just saying that to get them to do it, and that they're still going to show up and barf all over the place. How do you help people understand what you're doing with them that's different from their visceral fear of getting these kinds of things?
Yeah. I think a lot of the fear either comes from one, a past traumatic experience, like you've had an IUD or some procedure and it was horrible, or a whole lot of misinformation or no information. And so there's just a lot of stuff. I don't know why IUDs get such a bad rep. There's stories of like IUDs wandering around the body. It's just like, where is this coming from? I don't really know. I think number one is I'm really curious about where people are coming from and what their stories are. And so just being heard and having a healthcare provider actually listen to their experience is so, so valuable. And that immediately allows them to have more trust in the process. And the second part, which is the fear of the whole procedure. And so there's no surprises. I'm going to tell you exactly what's happening before we even get to that appointment. I'm bringing you through the process. First, we do the ultrasound, then we do this, then we do that, so that they kind of know what to expect when they come into the office. And I'm going to repeat it again and again and again, because when you're anxious and afraid, information is like, right? And I'll tell people, like, did you remember when I said this? And they're like, actually, no. And it's like, that's completely normal because your like nervous system is so jacked up because you're so afraid. And that is also part of the pain experience, is the anticipation and the fear going into this. So if we can kind of like let the guard down and make you feel comfortable before we even get to the actual insertion, it's going to go way smoother.
And the fear, like the trust is huge here. And that all the steps that you take to help encourage that trust are obviously very important. how are you finding people's response to you? And are they like, okay, I actually feel like I'm trusting this process? Is it like 90% of the time? Is it 100% of the time?
Like trusting me to complete the the insertion.
I'm curious how many people actually are like healthfully disarmed, like not just disarmed because you like massage them mentally and emotionally, but because they're just like, you know what? Yes, I will follow through. You have helped me understand that this is not going to be what I heard from so-and-so.
I would say it's probably still somewhere between like 50 to 70%. Even, as good as I am, I really think that like back of the head rhetoric that people hear or tongue
But it's so
from their friends or from this TikTok that they saw, they still come in. It's not that they don't complete the procedure. Oftentimes after the fact, they're like, oh, that actually wasn't so bad, or it wasn't what I expected, or it was much better than I expected. But I can still see that their body is armed, right? It's like, bracing for impact, even when I've like explained everything. But I really think that, which is mind-boggling to me, because I feel like this is not revolutionary. Like, you have a choice and you get to decide and you can say no. That should be standard. Like, I really feel like the bar is set so low in this area. It's like, why are we not using pain management? This seems so simple to me. But I don't know where I was going with this, but basically is that I think when people learn that, one, they can trust me, but also they can trust themselves, that is where like the magic happens. And I want to encourage women to trust their own bodies.
How do you help them, not psychologically, not mentally? How do you physically help them not experience the kinds of pain stories we hear that people go through providers that say to them, like, you don't need anything, you're numb down there?
Yeah. Okay, well, there's many different things that we do. Number one,
I love this bit because I will read it.
Okay, we start with Advil, ibuprofen. A little ibuprofen before you come in for your visit. That's just kind of like a preemptive. We're going to help support cramping through the procedure. That's like the bare minimum, right? I have only ever had one person decline a cervical block, which is where we basically put lidocaine, which is an anesthetic, so it blocks pain throughout the entire cervix. And so here's our little anatomical.
I actually don't know how you do this, so I can't wait to see this.
Yeah, so I mean, this is like a tiny little muscle.
She brought props.
We'll block the sign here. So we have the vagina here. We have the cervix. That's the opening to the uterus. And yes, the cervix does experience pain. It's different than other parts of the body. But we basically put a little needle. It's kind of like when you get your tooth numb to get a cavity. We put 2 needles into the cervix. It's kind of hard to demonstrate with this. And that blocks some of the pain experience through the cervix.
What does that feel like?
That is so variable. Some people are like, oh, I didn't feel anything. And some people are just kind of like, oh, like it's kind of just jarring. Again, like you don't have the same pain receptors that you do in the skin. So it's not like poking your arm with a needle. So it's more like pressure, like a deep pressure feeling or like a heaviness. But, I tell people if you've ever had a cavity done, it's like the initial poke is like, ooh, but then once it's in, it's numb.
And the standard of care is to offer this or not offer this?
It's changing. So now, yes, it should be up. It absolutely should be offered. Lidocaine. This is newer because when I had my IUDs done, which was not that long ago, like let's say 4 years ago, I was not offered pain.
Because the guidelines suggested you don't need to, and that's changed?
To be honest, I'm not quite sure of like what the Canadian Gynecological Association has on their guidelines, but I believe it should be offered.
And that if you're not offered it?
Find someone else.
Okay.
At least you should be offered it. If you want to decline it, that's your choice, right?
In my head, I always thought it was like the definitely a patriarchy, because like what isn't? But I also thought it was like cost. I thought maybe there's like, we're just kind of cheap in medicine. with stuff that we're like, we don't need to spend money on that in the healthcare system. So like, we're not going to provide the resources to like make this system be in place that might cost, I don't know, $15 per time if you can just shove it in there and call it a day because nobody feels anything. I feel like that's maybe part of it too. There must be some accounting thing happening, but who knows? Like, how are we ever going to know that?
I think it's cheaper than $15. It's way cheaper than that. But I think it's because there was this like idea that the cervix has no nerve endings. I think that is what, and also like how we don't listen to women. And every woman's like, oh my God, this hurts so badly. And it's like, no, like we're not listening. So I think maybe cost is part of it. But I also think that there was this idea that the cervix is not innervated.
So you then offer the Advil, the Lido.
Yeah.
Then what?
Then we also have this right here, which is called Penthrox. It's an inhaled analgesic. So basically another like pain management. Not everyone uses this, but for people who are particularly anxious or have a lot of like reservations around this or have had a previous insertion that was really painful, they can use this through the procedure. So it's better than Ativan. It's more effective than Ativan, which is...
Oh, let me tell you. I know someone who I called an ambulance on. You know who you are. And they were in a lot of pain. The paramedics came in. And I had never seen this before. And there's like, grab this whistle. And I was like, what is that? And there's like, make sure you like cover it, I think, because otherwise the whole room would get high.
Yeah.
And they're just like, make sure you cover it while you're inhaling. And then this person didn't do that. And they were just like, whoa, whoa, whoa. We're all going to be high at the end of this.
Yeah.
So like, make sure you cover it. And within seconds, they were not in pain from extreme pain before this. So when you guys started offering this, I was like, really? That's amazing.
Yeah. And you know what? A patient told me about this. So I'm learning every day from patients because it's frequently used in Australia. And
For this purpose?
Yeah, IUDs. And so I looked it up and I was like, oh, it's within our scope. Why not use it? Let's try it. So I used it on this first patient who kind of alerted me to this. And it was amazing. And so, yes, if you like inhale and kind of blow it out like a vape, there is going to be whoever's in the room can like inhale some of that. If you actually put your finger on here, it just gives you a more intense dose when you inhale.
And you're choosing to offer this. So now you've offered two things. This is the third.
Yeah.
You're choosing to offer this to select people, or you give everybody the choice and then it's like, no, I don't need that.
I pretty much give everybody the choice. And a lot of people will decline the Penthrox just because they're like, I don't think I need that. Or they've had previous IUDs and they're like, yeah, it was fine.
I would be whistling Dixie on this thing. I would be like, why would I not take it? I'm going to take all 5 stages of pain management.
True. Some people choose to not have it for other reasons. Like you need to have someone drive you home after. So if they don't have someone that can drive them home, they're kind of considering that as well.
Logistics.
There's a lot of logistics.
I know.
Yeah.
And then this makes them feel...
It kind of makes you feel tipsy.
Okay.
Kind of how, they're like, can I take this home? This is great. This is better than like party drugs. I'm like, no.
Let me just put it in your goodie bag.
We do take this away so at the end of the visit. But yeah, it really produces anxiety. It works very rapidly and it reduces also sensation of pain.
Does it make anybody, like, is there a side effect that people should be aware of so that they're like, oh, I'll get a headache later or something and I don't want to deal with that? Or is it like, no, it's pretty...
I would say there are possible side effects, but by and large, most people tolerate it really well and it's out of their system pretty quickly. In BC, we don't recommend driving for 24 hours, but that's again more of like a ICBC insurance thing versus it's still in your system tomorrow. No.
Oh, interesting.
Yeah.
So like it's not like a DUI.
No, it's just that if you, let's say, have an accident tomorrow and you had your IUD yesterday with Penthrox, they may not cover you for that. I know. That's crazy.
Oh my God.
Where were you yesterday?
That's such a tell. Like your girlfriend's just like, I can't drive anywhere today. And you'd be like, did you get an IUD yesterday? Why can't you drive? That's weird. What a tell. Yeah. So the 3 things. Are there... Okay, and actually, let's back up. Is this seldom used here?
I would say
amongst clinics?
it's becoming more common. So one of the main reproductive clinics here uses that.
Okay.
But again, like when I had my own experiences, never even heard of this. Was not a thing. So I think it's becoming more commonplace. And we just had the Women's Health update with UBC, and they talked all about Penthrox. So I'm very hopeful that this will be offered more for women, because it's just, again, like that anxiety and anticipation is part of your pain experience, and this really helps with that.
There's this like anticipation, yes, but there's the idea that why am I going to put myself through something that I've heard another person was tortured by? And I think a lot of these things reduce the torture factor.
Absolutely.
Is there another thing on top of this, or is this pain management in this world?
This is the main like devices or, things that we can use physiologically from pain. But then there's other things like we have heating pads and, maybe music, or people want distractions like they're on their phone, TikTok, or they have a person with them. Like that's also part of pain management and the whole experience. But these are the main medications that we use for pain.
Okay. IUDs, like this is about IUDs right now, but we're going to get into other things. My curiosity is IUDs in this province became covered by the province. They're like free basically for somebody to get. There's many choices of IUDs. There's hormonal ones that everybody wants to scratch my face off when I offer it to them. Why would you do that to me? I'm like, hang on. And then there's non-hormonal ones, and there's different versions in each. Can you walk through hormonal IUDs, and are there genuine concerns that people should have around hormonal IUDs that would make them not want to get one?
Again, the birth control, like the anti-birth control rhetoric, I'm like, I don't get the hormones, right? It's like everyone's like anti-hormone, but there's two main IUDs that have hormones in them in Canada, or other countries have other options. We have the Mirena, which is the brand name, and then the Kymena. Both of them are a progestin, so like a synthetic progesterone called levonorgestrel. And they have different doses, and physical size is also a little bit different. There are obviously concerns with any type of birth control that we want to make sure it's safe for, the person receiving it. Anatomical differences, if you have a bicornuate uterus, which looks like a little heart, we can't put an IUD in that because there's the other side that might get pregnant.
Oh, hold on. Is ultrasound necessary for IUD insertion?
Ultrasound is not necessary, but it helps a lot, and I think it should be required.
Because it would identify these kinds of things?
Absolutely. Yeah.
Because there are places that do not use ultrasound for insertion?
Yeah.
Is that like a common thing?
I think it's pretty common because not every GP who's doing IUD insertions has access to an ultrasound in their office.
So it's just blind darting.
Yeah. So ultrasound is so helpful. One, I can see the shape of the uterus before I'm putting anything in. And I can also check the placement after, make sure it's in the right spot. Because I have had countless people come in with chronic pelvic pain. And I'm like, well, let's check your IUD. That's like the first place to start. You have an IUD. It should be helping your pain, not making it worse. Have a hormonal one. And, IUD is not in the right place. It's like touching the cervix. It's moved down. So it's not where it's supposed to be at the top of the uterus. It has moved down into the cervix, which can be uncomfortable. So check your IUDs, folks.
And does that just happen? Or is it because it was placed that way?
Hard to say because I didn't place those ones that people coming with that after your first period. So you get your IUD, you get a period, let's say 4 weeks later. I don't know, depending on the timing. If you have a really heavy flow, you're at a higher risk for that IUD moving down or being expulsed. So like coming fully out. And that can also happen with young people or just like weird shaped uteruses. Everyone's different. And that can also happen because of malpositioned IUDs. So it just wasn't placed all the way at the top of the uterus.
IUD placement checks. I don't really hear about those from when somebody gets an IUD. I never really hear them other than, of course, from you and the Mint Queens. I don't know if that's a real thing. Like, I don't know if like people go in to check if their IUD was put in properly 2 weeks prior.
Yeah.
It's not.
Yeah.
So this is like a special but needed thing that you think should be part of the standard.
Absolutely.
Okay.
Yeah. I think in an ideal world, I mean, our healthcare system is obviously very squeezed right now. And so to have someone come back to like a really busy reproductive clinic that is doing like, thousands of IUDs is a pull on resources. So I get it. But at the same time, like checking your strings is not an effective way of checking your IUD. You can have long strings, short strings, your strings can move around your cervix and you cannot feel them, but your IUD might still be there. So the only and best way to check it is with an ultrasound.
Okay. My mind is very full at the moment. Okay. So when a person presents with what symptom picture that would eventually lead you to see that their IUD was misplaced? Like, what are they feeling?
It can vary dramatically because it depends on what's going on with the IUD, because there is a risk of embedded IUDs. So where the T, the top, more props, the top of the IUD, which looks like that.
I think you better like do the influencer thing and like do this.
Oh yeah.
With a camera. Yeah, okay.
So that can sometimes get, embedded, meaning it gets stuck into the muscles, I feel like, of the uterus.
Oh, it's so soft. Soft.
Right. Although some people have never seen an IUD and they're getting this device in them. So I always show people, I was asked if you want to see it. But some people are like, I don't want to see it. But like, you should know it's being put inside of you, right? It's a tiny little thing. This is a copper one. So let's say, this part is embedded. It sounds scarier than it is.
Embedded sounds horrible. It's an alien.
It doesn't mean that it's like all the way to the uterus. No, it's just that like it's gotten stuck in the muscle. So that can happen and that can cause like increase in pain, kind of like menstrual cramping, menstrual chronic pelvic pain. That's also happening outside of the time where you're getting a period. And with the Mirena and Kyleena, because they reduce bleeding, it can also be tricky to kind of track that because you might be getting cramping once a month and we kind of assume that that's your period, but you're not bleeding. Whereas some people will have chronic pelvic pain that is random and intermittent and it's kind of all the time. And so we're like, hey, that's not really consistent with a period cramp. So that can happen. It can also move into the cervix, which can feel uncomfortable during sex or intercourse. Some people will say that their partner feels their IUD. That I think is a bit of a stretch. Is probably the strings, not the actual IUD itself.
I mean, not a bit of a stretch.
So there's all kinds of.
A male partner would feel what? Like what part of this?
So these strings here, let's pull this out. So this gets placed into your uterus, right? And then we don't leave these strings like it's in a, fishing wire. We cut them. Now, if they're cut too short, it can feel very like pokey to a penis. And sometimes even if they're long, they'll kind of tuck in behind the cervix. And some people will say they feel it. But I would say unless the IUD itself is all the way down into the cervix, like fully coming out, you wouldn't be able to feel this actual IUD.
I mean, it's a lot. It's just very soft. Like nothing about this is rough or hard at all. It's just very soft. Even this is like silk.
Yeah, it's silky. But when it's short, like you can imagine like this part.
Yeah. I mean, I'll never know. But yes, I can imagine.
Yeah. So, everyone has a different pain experience. I'll never discount or say like, oh, that's not a symptom of, your IUD bleeders and like, it's like, let's just check it. Everyone feels things differently. And then we can know.
And when you check it, are you then having to remove it and put another one in because it's misplaced or can you fix it?
do not try and like push your IUD back in.
I'm glad I asked.
Bad idea. No. If it's not in the right position, one, it may not be effective for what you're trying to use it for, mainly birth control. Bleeding, maybe another story. So yes, we need to remove it and put a new one in,
I see.
ideally.
Is there a cost associated with that? Like if somebody has a misplaced IUD that was 6 months ago and now they're like, I'm in pain, something's going on, and you see that it's misplaced, is that covered for them?
Yeah.
Oh, okay.
In British Columbia, yeah.
Okay. So there's no limit of number of IUDs that a person gets in like a year if something like that happens.
I mean, probably if you're getting like one a month, the pharmacist may be like, what's going on here? But generally, you know, if it's within 6 weeks and you have an expulsion, we can actually call the distributor of the IUD and get a replacement because it's kind of like a device error. But if it's longer than that, we usually just represcribe and get a new one from the pharmacy.
Yeah, I can't imagine somebody's in some back lane selling IUDs because they just grab them monthly.
With the amount of anti-IUD ideas online, I don't think that's happening.
Okay, we're going to go back to non-hormonal IUDs and hormonal IUDs in a second. The is it Russian bots? Like, who? What do you think?
I mean, I think it's twofold. Again, I always blame everything on the patriarchy. I'm like, what does the patriarchy want? They want women confused and afraid and not informed. So yes, I think that's part of it. It's just that like propaganda machine. And the other part, I forgot what I was going to say.
The patriarchy. It's always both of it. Both the thoughts you had were the patriarchy.
Pretty much.
It deserves both silver and gold.
Oh, I remember what I was going to say.
How?
It came back.
Olympics.
No, I think it's because the bad experiences, people love to like shout those from the rooftops. So for every one bad experience you hear, but probably have like 100 thousands of people who love their IUD and are like, this is amazing. Like you have patients who are like, this is the best thing ever. Why didn't I get it sooner? Right.
My patients with endometriosis, chronic pelvic pain, that probably is something like adenomyosis or endometriosis, women with fibroids, women who just bleed heavily because that's something's going on in there. It is so much more than birth control. It is so much more than that. It is a therapeutic device. And we don't talk enough about how it's a therapeutic device because you don't need to bleed. Like you don't need to bleed. Do you need to bleed?
No.
There's that too. There's a lot of like, why would you as a natural approaching clinician offer me a piece of plastic with a metal coil on it or a hormone in it?
Yeah.
Why are you doing that? Because it's therapeutic.
It's therapeutic. It's effective. I want people to feel well. I want you to walk through your day not worrying about standing up and hemorrhaging. Yeah. You know, these are the stories that I hear. Like, oh yeah, I get up from my job and it's just like blood everywhere. That's horrible.
It's not even though it's just if you just don't want to bleed.
Yeah.
If you just don't want to, even if you bleed a small amount, whatever that is, if you just don't want to bleed, you don't need to bleed.
Yeah.
And I think a lot of people think that that's messing with nature and Gaia is going to come with a vengeance in 15 years and say, well, now you're not going to be able to have a baby because you didn't bleed. And that's not reality.
And the IUD does not work the same way that birth control, like the pill, works. They work in different ways. So I think that's also part of that misinformation that any hormone is bad for me and the birth control is the same as the IUD is the same as the implant. Like they all work differently. They're all different hormones and everyone, you know, has different experiences with all of them. And it's kind of like you need to find what works for you. So even if something didn't work, it doesn't mean that another option is not going to work for you.
Only if there's somebody available to walk you through that, though.
Only.
I thought the year of the dragon. So let's go back to the hormonal IUD and the copper IUD.
Yeah.
The copper IUD, as a clinician, I always, unless there's a contraindication to getting a hormonal IUD, like a cancer, I always am just like, go get the copper.
Yeah.
Am I right or wrong or somewhere in the middle of that?
I think it's definitely a nuanced conversation because we know that the copper IUD typically makes periods heavier, potentially longer, and more crampy. So who wants more? It's eating the horrible, right? But for someone like myself who doesn't really bleed a lot and, is like, okay, well, let me try this, it can work. And I have many patients with the copper IUD that love it. And also you have people who don't experience those side effects that are like, my period's the exact same. I haven't had an increase in that. So I definitely see a lot more hormonal IUDs happening just because maybe that's just the population that I see, but a lot of people have heavy periods. They don't want heavy periods. And I would not give a copper IUD to someone who already has really heavy periods or fibroids or endo or any of these conditions that you were talking about.
If somebody comes in and they're like, which one would you tell me to choose if you could help me understand which one's going to be better for me? Do you want to sway towards a hormonal one because it has these extra benefits, or are you just like, no, you can totally go. And then if you end up having a problem with the copper one, then we can just switch it.
Yeah. I mean, I definitely obviously take a little bit more like gravitas towards that conversation because we don't want to have to switch out your IUD, 6 months in, because again, that procedure requires a lot of thought and, anticipation. So if someone comes to me and is like, I want a copper IUD, and then we kind of talk about, okay, your periods are really heavy and they're long, and I don't think that this is the best option for you. And I think the hormonal is a better option, but they still want to try the copper and they're informed about all of the risks. That's their choice. So I'm still going to provide them with that option. And if they want to come back and switch it after, great. But they need to know what they're walking into.
One of the things that I think is very important, again, as a referring clinician, is I've seen many women, so please comment on this whole scenario. I've seen many women get an IUD and they have lots of side effects from it. They're like bleeding every day for 3 months. There's one woman, she was bleeding every day for 8 months. Oh gosh. And she came in and she's like, nobody will remove this because they said, wait a year. Her hemoglobin was like 95 at this point. She had a ferritin of 3 or something to that effect. And we're just like, sorry, the person who inserted this needs to remove this. And she's like, no, they keep convincing me that I should just keep going. A year is the threshold to let me know that I've passed it and they'll probably be over this chaos of that first year.
That seems very long to me. What I learned and what I believe the research says is 3 to 6 months is the average time for your body to get used to the device. Yes, you can expect some like intermittent bleeding and spotting and cramping with any IUD, Mirena included. And that's just as your body gets used to it and it changes the lining of the uterus. If it's past 6 months, I think another conversation needs to be had where maybe this is not the right device for you. I've even had women come 2 months after and they're like, I really don't want this. And I explain that 3 to 6 months and they're like, I still don't want it. Mm-hmm. Out she comes.
See, I think the reason that like outside of your world, they maybe want to dissuade women from having it removed because one, that now adds another person's appointment into a system that's already overloaded. So it's just like, no, like you'll be fine. Don't worry. And that would involve like a culture change to allow for women to think that they can just have it removed within a 2 month to 3 month period. And then you'd have this whole like maybe ocean of women who are like, get it out of me. And they kind of want to be like, don't prematurely make him, but it's your body and it's your choice.
That's informed consent. That's literally what informed consent is. You understand the risks, the benefits, and what's going on and all of that information, and you still decide, I don't want this, then you cannot want it and take it out. Like, it just drives me up the wall to hear these stories that people are denied medical care when they are like smart individuals that understand what's going on, and people are like trying to convince them otherwise. And that, again, goes back to like the trust in one's own body, trust in the healthcare system and their healthcare provider.
And I think just that healthcare fails us all the time because the decisions that go into what somebody says to a patient are often not based off of like right here, right now for you as a person. It's the accounting department, the ministry, the budget, and then the culture of your specific clinic, the culture of your hospital, the culture of like colleagues being like, we don't do that. So why would you do that? You don't want to be this like black sheep amongst people who judge the shit at you all the time. And so you just kind of just like, oh, I guess this is what I'm doing. This is how it is. But then, weirdos like you come along and are just like, no. And then so people like me question, are you really weird? Are you like really so different? Or are you representative of a year from now, things are going to be different because you're just like a year ahead of the curve?
I have no idea. All I know is that I was raised by a very strong mother, and it was no means no, yes means yes, and like you decide. And I think that I'm very lucky and grateful to be in this position because I get to like empower my patients and give them that opportunity and spread that message through their visits to say like, oh, you should come to her because in telling your friend because she actually listens and she's actually going to like help you feel better versus deny you what is needed.
Do you call your mom mother of dragons?
It's funny because my mom's, we're from Quebec, so they don't take the last name of the husbands. Oh, yeah, it's very matriarchal. They keep their maiden name.
It's to me. Oh my God, the French.
Yeah, so my mom is still Le Pouchef. Yeah.
So it's the father of dragons.
Actually, my dad goes by X-Man Daddy-O. Long story. But yeah, Mama Dragon.
You could be Mama Dragon. Yeah. Well, Mother Dragon. No other ideas anything to say about her. So when we're talking about women's healthcare, we're talking a lot about the options. IUDs, to me, are so representative of what's happening in the world, right? Like it reveals all of the misinformation, the patriarchy, and its influence in everything, like freedom of choice, my body, my choice, pain management. It just reveals so much about what the state of affairs are.
Absolutely.
And so I think it's such a great like microcosm of like what's actually happening.
Absolutely.
How else do you see this kind of like, what else are you doing that you see similarly? Like, are you doing other services that you're just like, yes, I'm trying to forge or change the way things are done outside of IUDs being offered?
Any sort of birth control counseling, I think, is super important because, I mean, birth control is feminism. It's like it gives us our power, that's not why birth control was created. It was created for heavy bleeding. They discovered that, side benefit, stops babies from happening. But that allowed women to then go into the workforce and, have our own lives and make our own money. So I think that empowering women to have these choices is so important. I also think that any type of sensitive exam, like a pelvic exam, a PAP, or, even just like looking at some skin that people are worried about, I have this spot, approaching that with care and compassion and understanding is so important because, again, like all comes back to me as a little girl going into the doctor's office and for some reason feeling so like nervous, almost as if I was going to write a test, that I had to say the right thing. And then I can't just like spill my guts and be like, this is what's happening to me. You can do that in my office. Tears are welcome. Everything is welcome. Let it all hang out. There's no judgment.
What are the like most common or like even examples of people coming in and saying something to you that you have to really correct about birth control or any of this world? Like, what are you hearing yourself saying just like, that is not it?
I think that like all hormones are bad. Blanketing that all hormones are bad. People being like afraid or icked by the IUD because it's in the uterus and it's in the place that it shouldn't be. I think it's a lot of like ideas that people create in their mind. Even the implant, it's very interesting actually. I find that like you have two camps of people. So you have the implant, which is like a device that goes into the arm.
Is that
that's what this is? Yeah. So it's this flexible rod here. I can pull it out.
Oh yeah, okay.
And it gets placed under the skin.
Like a little mustache.
I know. Smile. And they get placed into the arm and You have some people.
Sorry, not a mustache. Not the patriarchy just spilling out of my mouth. Well, like a mustache. That's not where those coming from.
You have some people who are like so for that and so against IUDs, and then you have the opposite. People who are like, implant, like I don't want that in my arm. And some people are, I don't know, it's like these ideas that we create of like where things should be in our body.
Right.
And I just think that like we live in a modern world. This is modern medicine. I love herbs and traditional, herbalism and all these kinds of things. Why can't we like meld the two and get the best of both worlds and feel good and have efficacious, devices for our modern...
Tell me about that device. Like, what does it do?
This is similar to the IUD, except it doesn't go in your uterus. So it's actually, you can feel it under there. That's what it feels like.
Oh, just like a hard muscle.
Yeah. It goes in the arm. It's called, the brand is Nexplanon, but it's etonogestrel. So similar to the IUD progestin. It's a little bit of a higher dose. So works in a slightly different way than the IUD does. Similar, but different. And it's still used for birth control. And some people also use it for bleeding control. So I do find that a lot of people from different countries, like I'll get people from like Africa or Australia, like love this device because I think it's more commonplace.
Oh, okay.
But Canadians are like, implant in my arm? Ooh. So
it does feel very like Neuralink. It feels very Elon. And like, is it going to start beeping?
Just call my mom.
Or like one day, like I can understand that to be like just the word implant.
Yes.
Like the word embed that you said earlier, like those leave a little bit of a mark.
Yeah.
Like when you say them. So like implanting something, you're just like, oh, that sounds serious.
But again, it comes back to the culture because why are there like hordes of women from Africa and Mexico that are like, whatever, like, yeah, that's totally normal, right? Like everyone has it. So I think it's just, we need to kind of catch up here with some of these devices and that they're not scary. They are what they are and they're not for everyone, but a lot of people can benefit from them.
Right. Can you talk a little bit about something that I see a lot and I would love your understanding on in perimenopause and in menopause? The idea of using an IUD or birth control in these times to help with symptoms. How do you approach that with patients who are like a 48-year-old woman who has heavier bleeds? They come every 3 months or whatever, they're irregular. And they're just like, I'm done. Can I just be done?
Yeah.
How do you help them be done bleeding with all of this?
Yeah, there's many ways. Birth control can be an option. It doesn't work for everyone. And you can have breakthrough bleeding. But if someone's like, I don't want to have heavy periods that are inconsistent and all over the place, it's like you're in puberty all over again. Like when I was in school and you're like, oh my God, there's blood on my pants. Like run to the washroom. Nobody wants that when they're 48 and they're like an executive CEO. So we've got options, right? The IUD is a great option. The Mirena, it lasts for 8 years. So it can take you through menopause and beyond. You don't need to bleed. It protects the uterine lining. So we can use it as hormone therapy and in addition to hormone therapy. So that might not be sufficient on its own to control all of the symptoms of menopause, and same with the birth control pill. So again, it's kind of like finding the right recipe for you. Everyone's different and you have to try different things to see what works.
Is it becoming more popular for women in their 40s to get things like this to help with perimenopausal bleeding?
I think so. I think the message is spreading. And these are the types of people that I get that are like, why didn't I put this in sooner? Like this is a game changer.
I get that all the time.
I get exhausted because I'm like not iron deficient anymore, right? That plus an iron infusion, it's a whole world.
I hear that all the time, that women in their 40s who get IUDs. So like we're thinking about this from the perspective of like a woman in her 20s or in her 30s who doesn't want to conceive, etc. But there is the therapeutic benefit for women in their 40s and their 50s to have this thing in, and that prevents all of the tornado chaos that happens with your hormones affecting your uterus in really just unhinged ways that you don't need to experience. And so when I talk to women in their 40s or 50s to go talk to you and the mid queens about IUDs for this purpose, they're always just like, never even thought about it. Nobody brought this up. To the point that they're like, if nobody brought it up, is this not a thing?
Yeah.
Do you know what I mean?
I know. Yeah.
Is it not an option?
There's lots of things like that.
Yeah, if nobody brought this up to me, are you bringing it up because you're weird and you're like saying I should do something like this because you're sort of fringy? It's like, no, honestly, it just maybe give it 5 years. It'll become just part of our society where women in their 40s and 50s are offered IUDs and they just don't need to experience the uterine effects of perimenopause.
Mm-hmm.
I hope that becomes more normalized too, because it's life-changing.
It is. It is life-changing.
Okay, I have a couple more questions. I am conscious of our time. So when we were talking about also hormones and how the word hormone, you just said that, is so scary for some people. And you're dealing with hormones and you're like putting hormones in people's bodies. How are you having that conversation with them? And what are they asking you? What are they asking you this? Like, but I'm going to get blank.
But I'm going to get cancer. That's always a concern. I think because of the WHI really put a damper on hormone therapy. If we're talking in the context of hormone therapy, I would say that the young patients that I see, like the teens and the early 20s, the Gen Zers and the Gen Alphas, this is not even on their radar. They're like, whatever, yeah, sure, IUD. Mm-hmm. Cancer is not on their radar. So nothing is on their radar. They're just like, can I have sex? Great. So I do think that is changing because the new generation is more like proactive on this. And I think that's because their moms are the ones that are like suffering and are like in their 50s or are just like, this is horrible, do not suffer. So the people in their 30s, 40s, 50s always ask about cancer, always ask about the stories that they hear about the IUDs wandering all over the place. I think that's a major concern when it comes to a device. The hormones themselves, they just don't understand how it works. So when I educate, I mean, doctor is teacher, right? This is one of our pillars of naturopathic medicine. When I explain people how it works and what it does, they're like, oh, that's not so bad. It's not as bad as I thought. Because again, it's just like they get one piece of information and then their brain extrapolates. And it's like, oh, it's going to stop ovulation and this and that. And like, that's going to cause cancer. And it's so bad to stop your ovulation and affect your brain. And I don't know, like with these ideas.
I mean, you don't know because it doesn't make any sense. So you're trying to make your brain make no sense.
Yeah. So, we have very intelligent people in our offices. If you explain to them the mechanisms and how these things work, they're more game to try them.
Where do you work? Where's your office?
I work at Mint Reproductive Health, which is just down the street on West Broadway. And I also have my own practice out in Coquitlam at Regen Holistic Therapies. So I'm there most of the time, but I do love my days in the city.
Yeah, she does. I am so grateful for this conversation. It led to all kinds of really important things to discuss. Lastly, would you show me your ovaries?
Here's my ovary. Only one of them.
Yeah, is that so cute?
And here's the ears.
Shh, please. It says Ova Achiever. Thank you so much, Dr. Dragan.
Thank you.
Mother of all dragons.
This is great.
Yeah, we'll have you back. Bye, everybody. Thank you so much for joining me today. I really had a great time, and I hope you did too. Please share this with a friend or a lot of friends, and leave me a review. It really helps promote this podcast. Thanks so much.